Hello, my name is Blake Grothaus, and I have epilepsy. Epilepsy is a brain condition often misunderstood as just one type of event. In reality, it's a spectrum. Seizures can look very different from person to person. The brain uses electrical signals to control everything we do. In epilepsy, these signals sometimes misfire, causing a sudden burst of activity, a seizure. Seizures can affect how a person moves, feels, or behaves. But not all seizures are the same. Think of the brain like a city's power grid. A small glitch might only flicker a few lights, while a major outage can black out the whole city. Some seizures start in one small area. Others involve the whole brain from the start. That's why doctors classify seizures as either generalized or focal. Generalized seizures begin on both sides of the brain at once. Focal seizures start in one spot. This distinction is crucial for diagnosis and treatment. Recognizing the type helps families and doctors respond appropriately. Understanding these basics is the first step to managing epilepsy. The starting point of a seizure shapes its symptoms and guides medical decisions. Knowing this helps demystify epilepsy and supports those living with it. Generalized seizures are like an electrical storm hitting the whole brain at once. They almost always cause a loss of consciousness. People won't remember the event. The most dramatic is the tonic-clonic seizure first. Muscles stiffen, then the body jerks rhythmically. Another type, absent seizures, are subtle, just a few seconds of staring or spacing out. Generalized seizures can be dangerous, leading to falls or injuries. Afterward, people often feel exhausted and confused, needing time to recover. Absence seizures, though brief, can disrupt learning or work. Diagnosis relies on witness accounts and EEG tests, which show abnormal activity across the brain. This pattern confirms a generalized seizure. Knowing the type helps doctors choose the right medication. Not all drugs work for every seizure type. Understanding generalized seizures is key to safety and effective treatment. Focal seizures start in one specific area of the brain. Symptoms depend on what that part controls. Jerking in a hand, strange smells, or visual changes. There are two main types, focal aware and focal impaired awareness. In focal aware seizures, the person stays conscious and remembers the event. They might feel odd sensations or emotions, but know what's happening. In focal impaired awareness seizures, consciousness is altered. They may stare, wander, or make repetitive movements with no memory afterward. Sometimes a focal seizure spreads and becomes a generalized seizure. This is called a focal to bilateral tonic-clonic seizure. The initial symptoms can act as a warning or aura before the seizure spreads. This progression is a key difference from seizures that are generalized from the start. Recognizing these signs helps with faster diagnosis and better care. Focal seizures highlight the complexity of epilepsy. Each person's experience can be unique. For those with epilepsy, the difference between seizure types is dramatic. During a focal aware seizure, people are conscious, aware of odd sensations, but unable to stop them. It's unsettling, like being a passenger in your own body. Generalized seizures, especially tonic-clonic, leave a blank space. No memory of the event, just confusion and exhaustion afterward. Absent seizures are brief gaps in awareness, often unnoticed by the person. To an observer, focal aware seizures might look like a pause or distraction. Focal impaired awareness seizures are more obvious, blank stares, repetitive movements, and unresponsiveness. Tonic-clonic seizures are unmistakable, with dramatic convulsions. Recovery varies. Focal aware seizures resolve quickly. Focal impaired awareness and generalized seizures can leave confusion or fatigue. Understanding these differences helps families and friends respond appropriately. Each seizure type affects daily life in its own way. Recognizing them is vital for support and safety. Can someone have both generalized and focal seizures? Absolutely. This is called combined generalized and focal epilepsy. It means the brain can produce both types of seizures, sometimes for different reasons. Causes might include genetics, brain injury, or structural differences. Diagnosis is more complex. Doctors rely on detailed descriptions and EEGs to spot both patterns. Treatment often requires a mix of medications since some work better for one type than the other. Managing combined epilepsy takes patience and careful planning. The key is understanding that epilepsy isn't one size fits all. Recognizing the differences ensures the best care for each person. Knowledge empowers patients and families to manage epilepsy more effectively. Subscribe to help support.